Hello everyone, my name is John. Welcome back to the Map 30 Challenge channel. Now today we have the sugar industry and a busload of money who tried to bully the WHO, the World Health Organization. And the World Health Organization stood their ground. And this story reminds me of something that my mom would say. They got a little too big for their britches. I think you're gonna like this story. Let's get into the details. In April 2003, the World Health Organization was about to publish something the sugar industry didn't want you to see, a scientific report based on 2 years of research, reviewed by 30 independent experts. The conclusion was simple. People should get less than 10% of their daily calories from sugar. For the average person eating 2,000 calories a day, that's about 50 grams. 12 teaspoons. Not much when you realize a single can of Coke contains 39 grams. The report was scheduled to launch on April 23rd, but the sugar industry had other plans. On April 14th, 9 days before publication, the Sugar Association sent a letter to the head of the World Health Organization. The message was clear: kill this report or we'll kill your funding. This is the story of what happened when an entire industry tried to silence global health science, and what it reveals about how far corporations will go to protect their profits. The letter went to Dr. Gro Harlem Brundtland, Director General of the WHO. It was signed by Andrew Briscoe, President of the Sugar Association. Here's what it said. We will exercise every avenue available to expose the dubious nature of the diet, nutrition, and the prevention of chronic diseases report, including challenging its funding from the U.S. translation. Withdraw the report, or we will lobby the U.S. Congress to cut off your money. At the time, the Sugar Association claimed the WHO received $406 million annually from the United States. That number turned out to be inflated. The actual figure was $177 million, but the threat was real. The sugar industry was telling the World Health Organization, your science or your survival. Choose, and they weren't bluffing. The Sugar Association didn't act alone. They assembled a coalition. The National Corn Growers Association joined in, so did the Snack Food Association. The U.S. Council for International Business, representing over 300 companies, including Coca-Cola and PepsiCo, signed on. Together, they wrote to Tommy Thompson, the U.S. Secretary of Health and Human Services, demanding he pressure the WHO to withdraw the report. But it gets worse. 2 U.S. senators got involved, Larry Craig of Idaho and John Breaux of Louisiana, co-chairs of something called the Senate Sweetener Caucus. They wrote their own letter to Thompson and the Agriculture Secretary, asking them to get WHO and the Food and Agriculture Organization to cease further promotion of the diet report. Here's the part that matters. Senator Craig had taken over $36,000 in campaign contributions from the sugar industry in the previous election. He was the 4th largest recipient of sugar money in Congress. This wasn't about science. This was about senators carrying water for their donors. The sugar industry didn't just threaten the WHO directly, they activated the politicians they'd been funding to do it for them. The sugar industry claimed they had science on their side. Andrew Briscoe cited a National Academy of Sciences report that supposedly said people could safely consume up to 25% of their daily calories from sugar, 5 times more than what the WHO was recommending. If true, that would completely undermine the WHO's credibility. But there was a problem. The report didn't say that. Harvey Feinberg, president of the Institute of Medicine, the organization that published the report, was so alarmed by the sugar industry's misrepresentation that he wrote directly to Secretary Thompson. His message: the sugar lobby is lying about our research. The report does not make a recommendation on sugar intake at all. The sugar industry wasn't just fighting the WHO's science. They were fabricating their own. The WHO had a choice to make. They could cancel the report, avoid the confrontation, protect their funding, or they could publish the science and risk economic retaliation from one of the most powerful industries in the world. On April 23, 2003, the WHO published the report. The 10% sugar recommendation stayed in. The launch went forward as scheduled, and Dr. Brundtland made a statement. Our primary responsibility remains to our member states and their people. The sugar industry had failed. Think about what almost happened here. A global health organization funded by governments, staffed by scientists tasked with protecting public health, was threatened with financial destruction for publishing peer-reviewed scientific evidence. The threat came from an industry that profits from selling a product linked to obesity, diabetes, heart disease, and metabolic dysfunction. And that industry had enough political leverage to mobilize U.S. senators and cabinet members to carry their message. If the WHO had folded, the precedent would have been catastrophic. Every future health guideline would be vulnerable to the same kind of economic blackmail. Publish what we want or lose your funding. Now, I want you to think about what would make the sugar industry so bold that they would openly offer a subtle threat to a government institution. What would make them so bold to do that? Well, I think it's a few things. And it's not a stretch to say that, one, they had a few government officials in their back pocket. They are funding their campaigns, so they feel like they may have had a little bit of leverage. The second thing is that if this report gets out, they know that their industry, the sugar that they're selling, is going to take a hit. No ifs, ands, and buts about it. They have shareholders that they have to answer to. So it's not a stretch to think that maybe they're a little bit concerned about how they're going to explain their profit and loss statements to their shareholders. But the World Health Organization had the science on their side. The science was clear, especially by 2002. It was crystal clear that obesity was an epidemic, and it was all because of sugar intake. So the World Health Organization was concerned about people's health and not the sugars industry profit and loss statements. And because they had public health in mind with this report, they stuck to their guns, and there was nothing the sugar industry could do about it. So hats off to them. But the WHO didn't fold, and because they didn't, countries around the world had access to the scientific evidence they needed to develop their own dietary policies. Over the years, the science kept proving the WHO right. In 2009, the American Heart Association published guidelines citing the WHO's 2003 report. They confirmed that excessive sugar consumption encourages weight gain and obesity. In 2015, the WHO didn't just reaffirm the 10% recommendation, they strengthened it. They said reducing sugar intake to below 5% of total calories would provide even more health benefits. That's about 25 grams, 6 teaspoons, half of what they recommended in 2003. As of 2020, the WHO still maintains that guideline. Less than 10% of your calories from added sugar, ideally less than 5%. The sugar industry tried to suppress that science in 2003. They failed, and 20 years of research has continued to prove them wrong. Here's what you need to understand. The sugar industry knew their product was harmful. They had access to the same research the WHO did. They knew that high sugar consumption drives obesity and metabolic disease, but instead of reformulating their products or warning consumers, they tried to silence the scientists. They inflated funding numbers to make their threat sound bigger. They misrepresented scientific reports to make their position sound credible. They mobilized politicians they'd been funding to apply government pressure, and they demanded that a global health organization cancel a peer-reviewed report because it was bad for business. That's not a company making a mistake. That's an industry choosing profit over public health, deliberately, strategically, with full knowledge of the consequences. And when you look at obesity rates, diabetes rates, and metabolic disease rates over the last 20 years, when you see how much worse the problem has gotten, you have to ask, how much damage could have been prevented if the WHO's 2003 guidelines had been widely adopted instead of suppressed and attacked? The sugar industry didn't just try to bully the WHO. They tried to keep you from knowing the truth about what their products do to your body. They failed in 2003, but they succeeded in delaying action for years, and millions of people paid the price. Now, before we end, I just want to take a moment to step back and reflect on what happened here. How the WHO stood their ground when they were challenged. Because I know we hammer them on some of the things that they've done, some of the decisions that they have made. However, I don't want to sound like a demagogue, and I don't want to paint everybody with a broad brush. It's bad, it's always bad, it's bad all the time. I don't want to do that. The goal is the truth. What is the truth? That's it. But we have people who are working here at the WHO who are just regular people, trying to provide for their families, trying to do the best they can to make sure that the public's health is protected, your health and my health. So I don't want to just paint with the broad brush, okay? That would be extremely unfair to do that. The WHO organization, think about it like this here. The WHO organization was developed with public health in mind. That's why they're there. Have they made some bad decisions? Absolutely. But the truth is the good, bad, and the ugly. And that's my goal, to give you all of it. So I just think it's important for me to point that out. I hope you got value out of this video. Don't forget to like, share, and subscribe to my channel. And we will see you in the next video.